In this video, I'm going to be doing a deep dive into pentoxifylline. It is a medication commonly used for the treatment of Peyronie's, but how effective is it? Well, put your science hat on, because we're going to be doing a deep dive into what it is, how it works, what it's used for. We're going to go through some studies to discover the theory behind it and how we could potentially use it for not just for Peyronie's, but for PE. I'm going to be giving you my thoughts on this and whether you should take it or not. More so, I'll be going over dosage, side effects, and more. It's going to be a very comprehensive video, so let's get started. Okay, so first of all, what is pentoxifylline? Sometimes also pronounced on pentoxifylline. I'm used to just saying pentoxifylline. It's basically also known as Trental. It was invented, released in around 1972 up in Germany. So it's a medication that's been around for a long time. What it is basically a vasodilator in a sense, because it basically improves the flow of blood by reducing its viscosity. It's mainly used for the treatment of something called claudication, which is essentially when you have problems delivering blood to the extremities of the body, such as the finger, the arms, or the legs. And when people basically feel those pricks and needles because there's a lack of blood reaching those extremities, it increases the amount of oxygen delivered to the blood by the blood to the muscles. And it's basically a non-specific PDE inhibitor. But mainly, what's the most interesting part is that it improves the flow of blood because it reduces the viscosity. So it's a bit of a blood thinner, essentially. So it is approved by the FDA to be used in the treatment of claudication, as I mentioned, where you have like tingling sensation in the extremities. But also off-label usage. There's a lot of usage, a lot of ways that doctors use it off-label, which means like it's not FDA approved for these usages. One is for ulcers. Like for example, venous ulcers. These are like the nasty ulcers that people get that don't heal up mainly on their legs and on their skin. I'll try to put a picture. It's pretty gross, actually. It also for the treatment of alcoholic hepatitis. What it is basically it's a TNF alpha inhibitor. So TNF alpha is also known as tumor necrosis factor alpha. Is basically it's just something that helps tumors grow. And so what it is, pentoxifylline is an inhibitor of that. So basically it helps with like the specific type of tumor growth factor, specifically in the treatment of hepatitis, alcoholic hepatitis, because they get like tumors in their liver. And more interestingly, at least for us, is that it's used for the treatment of Peyronie's and corporal fibrosis. And this is what this video is going to focus mostly on because, due to the nature of this channel. So it's used off-label for the treatment of Peyronie's and corporal fibrosis. So basically, if you injured your penis and you develop like a plaque or scar tissue or fibrosis or calcification, if in the case of like Priapism or long-term ED and you develop corporal fibrosis, this is used for that. And the reason it's used for that is because it actually decreases fibrosis. It's been known to decrease calcifications, and I'll go through some of those papers right now. And also reduces inflammation, which is very critical in the case of the acute stage of Peyronie's. Okay, so first, I want to discuss its usage in the effects of Peyronie's, and I want to do that first by going study by study. So it's going to be a bit of an interactive video. So, hopefully, you enjoy science content as much as I do. So let's go ahead and look at this study first, this first study. Okay, so we're going to first look at this study called pentoxifylline attenuates transport TGF beta 1. So TGF beta 1 is essentially this growth factor that is known to basically induce Peyronie's in the tunica. It's this growth factor that specifically makes the tunica put down irregular collagen, specifically like the bad type of collagen, but more so, even if it's a good type of collagen, it makes it so that the body places it down in an irregular fashion. And it's also makes it so that it's non-elastic. And so so TGF beta 1 is actually is very important, and it's the #1 factor for Peyronie's. So we're gonna see basically, so pentoxifylline attenuates, so basically it reduces the effects of TGF beta 1. So on the extracellular matrix, so basically on the walls here, basically on the tunica. So as we said, TGF beta 1 is implicated in the pathology of Peyronie's. It plays a role in the collagen and elastin metabolism. So just basically, collagen is something in your body that gives things like your skin and other tissue strength and rigidity. And elastin is what gives it like that, not just the stretchiness, but the mechanism that allows the skin or the tissue to go back to its normal state. So let's say that you squish a tissue, elastin is what gives it the ability to sort of bounce back, whereas collagen is what gives it the rigidity and the strength. And they're both very important and interesting. I'll probably make more videos on that because it's not just interesting in the context of PE, but also in like wrinkles, skincare, stuff like that, which I like to focus that. I like to talk about that on my channel. In any case, so pentoxifylline basically reduces the effects of TGF beta 1 and has been utilized in the management of Peyronie's. So basically, they studied the effects of TGF beta 1 and pentoxifylline on the collagen metabolism, on the elastogenesis in the tunica. So basically, in the tunica, albuginea derived fibroblasts. So basically, these are like the plaques that appear in the Peyronie's disease. So basically, they took parts of the tunica, and they were basically studying the effects of TGF beta 1 and pentoxifylline. So tunicas from men with and without Peyronie's disease were cultured and treated with TGF beta 1 and pentoxifylline. And they basically like look at the effects of TGF beta 1 with the uses of pentoxifylline, when they applied both of them, and what were the results. So essentially, pentoxifylline inhibited the proliferation of the fibrotic tissue. So TGF beta 1 is what simulated the collagen deposition in the tunica. So the more TGF beta 1, the more the body produced this irregular collagen. What's interesting is that pre-treatment with pentoxifylline dramatically reduced the effects of TGF beta 1, reduced the amount in both men and with or without Peyronie's disease. So essentially, they took tunica samples for men that had both Peyronie's and didn't have Peyronie's. They had Peyronie's and didn't have Peyronie's, and essentially TGF beta 1 basically had the same effect. What's interesting here is that TGF beta 1 had a higher effect in the Peyronie's tunica, more so than the normal tunica. While it still did have some effect, it tells you that certain men are they're more genetically prone to develop Peyronie's because their tunica basically acts more like basically TGF beta 1 affects them more so than more than other guys. So this is why you see that some guys may injure the penis and they don't develop this collagen, or where certain men just are just more prone, even with the lesser injury, they develop the fibrotic scar, the fibrotic plaque from Peyronie. So they're very, very interesting. So basically, what's interesting is that the pre-treatment, it was like when TGF beta 1 was already present in the tunica, treatment of pentoxifylline was not very effective. But when the pentoxifylline was given before the TGF beta 1 basically appeared or was administered, it basically inhibited like the effects of the TGF beta 1. So we'll see a little bit as to what their thoughts are about it before I dive in here. So I'm gonna do kind of highlight some of the interesting parts of this paper. So pentoxifylline has been shown both in vitro and in vivo in rat experiments to induce the regression, right, the breakdown of collagen and TGF beta 1 mediated plaque formation. So basically, collagen that was built due to this TGF beta, which is like an inflammatory growth factor that appears in the tunica. So in clinical practice, pentoxifylline has been utilized for the treatment of Peyronie's, but the published data on the treatment are limited, and I'll go through more in a bit. So the first thing here is basically the tunica samples did not form the basically the elastin and collagen fibers without exposure to TGF beta 1. So basically, TGF beta 1 is what causes that like irregular Peyronie's plaque, that that collagen, that scar tissue, essentially. So after treatment of TGF beta 1, we see that in the tunica, basically the bad fibers started to appear. So as we said, pre-treatment with pentoxifylline 6 hours prior to the exposure of TGF beta 1 inhibited the construction of the collagen, essentially, in the tunica in a dose-dependent fashion. So essentially, the dosage of the pentoxifylline was important. The more, the better in this case. At the maximum dosage here, pentoxifylline completely inhibited, right, like the formation of that collagen in both the normal tunica and the Peyronie's tunica. Now, what's interesting is pentoxifylline given 6 hours after TGF beta 1 was given did not inhibit the formation of that the collagen, essentially, to a significant extent. Okay, so let's look a little bit about the discussion of this. So TGF beta 1 is a regular it's a regulator of normal biological functions such as cell proliferation, cell death, mobility, and so on. So it's a normal process. So Peyronie's disease has been intimately linked with that TGF beta 1, and TGF beta 1 injections have been demonstrated to produce fragmentation of penile elastic fibers and the thickening of collagen in the rat models. So pentoxifylline had an inhibitory effects on both basically on the creation of the collagen fiber, on the creation of the plaque, essentially. However, these effects occurred only when the cells were incubated with pentoxifylline prior to the exposure of the TGF beta 1. So it is logical to speculate, therefore, that pentoxifylline will have a modest effect in ameliorating existing plaque tissue. So if you have existing plaque that's past the acute phase, pentoxifylline will probably have a modest effect on it. At least this is what this particular study says. But will have an important role, may have an important role in Peyronie's disease by inhibiting the TGF beta 1 process, leading to further plaque formation. So as Peyronie's is a progressive and chronic disease, so as people that have Peyronie's know, it's like with time it gets worse, essentially. It's not just one episode. So if you're taking it, well, let's see here. So basically, it's a progressive and chronic disease. Interruption of the cascade of events leading to deposition of the extracellular matrix will likely be of clinical utility when administered during the active phase of the disease. So essentially, these findings suggest that pentoxifylline may be useful in the management of the early phase Peyronie's, or in case where there's concern about possibly development of Peyronie's. So essentially, if you have an injury, such as a fracture or other sort of penile trauma, this is very relevant for people that do PE, as we're creating essentially micro traumas, right? And should we get bigger injuries, then if we were to take this sort of as a safeguard, it essentially would stop the creation of the plaque. Now keep in mind that this is in a petri dish. This is not in the human body. So just something to keep in mind. And keep in mind also that like the tunica and sort of the parts outside of the tunica and the penis are poorly vascularized. That means that the medicine, when taken orally, has a hard time actually reaching the plaque, which is like which is why its effects on actual like in vivo, basically when there's an actual patient that's taking it, its effects on Peyronie's are a little bit when taken orally are mild, if any, at best, to be quite honest. Okay, so that study basically showed us how exactly pentoxifylline works, when it's best to use it, especially in the case of Peyronie's, and how important TGF beta 1 is in the progression of Peyronie's, and why we need to inhibit essentially what TGF beta 1 does. All right, so I think that was the most important article. Let's blast through a few of these other studies and then, give some more thoughts. So let's blast through a couple more of these studies real quick. So pentoxifylline is also used for the treatment of penile calcifications. So in the case of Peyronie's, it starts off as a fibrotic plaque. Basically, the body lays down irregular collagen, non-elastic collagen, elastin, and collagen type 3. So collagen type 1 and collagen type 3, mostly collagen type 3. eventually over time in a certain percentage of men, this plaque becomes calcified. And basically when it's calcified, it is extremely difficult to remodel, which is why it's so important to do traction, to take things like pentoxifylline early on, such that you don't even develop the calcification. In this case, we're going to see a study in which they used pentoxifylline in plaques that were already calcified. So this is a retrospective study. So basically in 71 men with a mean age of 51.9 years with Peyronie's disease and sonographic evidence of calcification. So of those 71 men, 62 of those men were treated with pentoxifylline for 1 year, and 9 with vitamin E or no treatment. So improvement or stabilization in the calcium buildup at follow-up basically was noted in 91.9% of the men treated with pentoxifylline. Okay, so we saw that the majority of men, 91.9% of men, saw an improvement or stabilization of the calcium. Basically, pentoxifylline helped reduce the calcification, or at the very least stabilize it, versus 44% of those only treated with vitamin E. Vitamin E is actually an antioxidant, and I'll do like a separate video on just vitamin E alone. So pentoxifylline users were much less likely to have a subjective worsening of their condition. So essentially, treatment with pentoxifylline appeared to stabilize or reduce the calcium content in the Peyronie's plaque, which is very interesting because it's used in the basically it's used to reduce calcification already. Okay, so here we have another study, basically commentary on the myths of the Peyronie's disease. And they basically just go through a few case studies, basically a few men who had Peyronie's and how they ended up getting treated. Okay, so this patient basically was placed on pentoxifylline for 400. He basically had a plaque measuring 2 centimeters by 1.5 centimeters with part of it calcified. Basically 1.3 by 0.9 centimeters was calcified already. And the patient was placed on pentoxifylline 400 milligrams. And I'll talk a little bit more about dosage a little bit later on. But upon follow-up, he noted improved curvature from 30 degrees to 10 degrees. However, it didn't fully resolve the dorsal plaque. This is through the oral ingestion of pentoxifylline. So what's interesting here is that upon the ultrasound, the dorsal fibrosis was still evident, but the calcification had completely resolved. It's very interesting. So essentially, pentoxifylline, even in the post-acute stage, for the prevention or even reversal of calcified plaques, is very, very interesting. Okay, next I want to quickly look at another study in which pentoxifylline was used in combination with an antioxidant. So let's look at that real quick. Okay, so basically, this is one of the latest ones. This has been thrown a lot around, especially in the Peyronie's forums and the Peyronie's community. So basically, patients with Peyronie's disease achieved complete plaque regression after a multimodal treatment with antioxidants. So it's not just antioxidants, it's antioxidants and pentoxifylline, at least in a couple of these cases. So they basically, this is like, I believe, a clinic in Italy. So, it's basically just one clinic, which, is just something to think about. So they basically had a few patients. So this case presentation, so case 1, 50-year-old man with a double penile curvature to the left and to the side. Normal rigidity. So basically they gave him antioxidants and a topical anti-inflammatory gel. After 4 years of the treatment, the patient no longer complained of any penile deformity or pain. The ultrasound did not show any plaque. So in this case, they didn't use pentoxifylline. Case 2, a Caucasian man with a lateral, basically sideways curvature of 30 degrees. So he had a congenital curvature of 15 degrees, which later became a 30-degree curvature. He basically took the antioxidants, the topical anti-inflammatory gel, the penile injections of pentoxifylline. So in this case, they directly injected the pentoxifylline into the plaque. So after 28 months of treatment, the patient presented with a lateral curve of just 15 degrees, so it basically went down by 50%, and he no longer showed any plaque. So, which is interesting here. So they injected the pentoxifylline right into it. Case 3, basically a 36-year-old man had a curvature, had a complex skin curvature of 15 and 20 degrees. The patient underwent, again, multimodal therapy of antioxidants, anti-inflammatory gel, and the injections of pentoxifylline. At follow-up, after 28 months of treatment, the patient presented with a dorsal curvature of 10 degrees, similar to what he had on the congenital curvature, and there was no nodules, and the ultrasound no longer showed any plaque. They did have, here's another study, which basically is the same study, but they go a lot deeper into it, including dosage and what exactly was in the antioxidants. In 307 patients with early stage Peyronie's, they divided into different groups, but essentially, one group was pentoxifylline twice a day with the antioxidant regimen, plus pentoxifylline 100 milligrams via a penile injection every other week. So 12 injections in all. So they were taking it orally, 400 milligrams twice a day, and getting it injected 100 milligrams every other week. Group B is basically the same, except for the pentoxifylline injections. And Group C was a control group. This one lasted 6 months. After 6-month treatment course, we obtained the following results. So the decrease in plaque volume, mostly in the Group A, which had the pentoxifylline injections, but also significant in the Group B, which just had the oral pentoxifylline. This is in combination with the antioxidants, and had a curvature reduction of 10.1 degrees and 4.8 degrees respectively. And now in the control group, plaque volume actually increased over 120%, and the curvature increased by over 15 degrees. So basically, we see how important, at the very least, the antioxidants. The more so, I believe that it was like the pentoxifylline that mostly did all the work. But, of course, you can take the combinational treatment. But this video is mostly about pentoxifylline. I think I'll make another video about the antioxidants, which I think is interesting. And of course, you can combine it. And speaking of combination, you can always combine these things. So personally, what I did was I took pentoxifylline orally. I took the antioxidants, particularly vitamin E, orally. Also took Cialis, as well as combined it with traction and a vacuum erection device and DMSO, in which I combine more pentoxifylline to really attack the plaque. Now, I'm going to have a different video on DMSO and how do you combine it with pentoxifylline, so that you can at least get similar effects as to what the injection did. And as you saw, they need a little bit less because when you take it orally, it's actually it degrades very, very quickly inside the body, and so very, very little of it actually reaches the plaque. So with DMSO, you can actually bathe the plaque in a pentoxifylline, and essentially not only reduce any potential calcification, prevent calcification, but essentially you can combine other things to reverse the fibrotic effects. In any case, here we want to quickly see a study of pentoxifylline with penile traction. So essentially, the results, basically 46 patients were involved in the study. There was a significant decrease in the degree of penile curvature after 6 months. The plaque size decreased significantly, right? And here they basically they were comparing pentoxifylline with this other medication called colchicine. I don't really know how to pronounce it, but colchicine, in theory has the same results as pentoxifylline, but it has a riskier side effect profile. So pentoxifylline is really what doctors would prescribe nowadays, and it's just basically a much safer version of what colchicine does. So here we see that with the combination of pentoxifylline and traction, you actually see even better results than just the pentoxifylline alone. Okay, so that was pretty exhaustive, but I really wanted this all to be backed by science. The problem I think with pentoxifylline in the context of Peyronie's is that there's not a whole lot of clinical data behind it. One of the only studies that was out there in which they showed that pentoxifylline was effective in the treatment of Peyronie's was actually retracted because its authors were basically accused and proven that they didn't do the statistical analysis very well. So that was the only study. But this newer study, in which basically is more like in vitro, show that it is effective. This other study with the injection shows that it's also very effective, but we definitely need a lot more data. But I think it was really interesting to sort of go through those studies for using pentoxifylline in the treatment of Peyronie's. All right, next I want to quickly dive into how pentoxifylline is used for the treatment of Priapism that resulted in corporal fibrosis. So we already saw how it can be effective in the petri dish for the inhibition of TGF-beta1, for the inhibition of that collagen deposition, for the break. We also saw how in vivo it was used for the breakdown of existing calcified plaques. Now we're gonna see, but we also kind of touched a little bit on how there's really not a lot of studies or a lot of data that suggest that it's effective for the treatment of tunical plaques that are not particularly calcified, which is interesting. And also the one that we saw in the treatment of the calcified plaques was a lot of it, at least most of the reduction in curvature and calcification was because it was injected directly into the plaque. So in the case of corporal fibrosis, it's a little bit different because, as I mentioned before, the tunica, parts of the tunica are not well vascularized. So the medicine is metabolized quickly when you ingest it orally. And this is why I don't think it's very, very effective, particularly effective when taken orally. As such, I combined it with DMSO to really attack my scar tissue, and make it even more effective. But also along with it, I did take orally. In any case, in the case of corporal fibrosis means when you have scarring or fibrotic tissue inside the corpus cavernosa, and so basically this can happen from priapism or even from long-term ED. This can cause issues like, let's say, if you're trying to get a penile implant, they basically have to take out that fibrotic issues, and it could cause very, very bad ED, which is where a lot of guys that have priapisms, especially long-term frequent priapisms, they end up developing ED and shortening of the penis because of the corporal fibrosis. So in any case, we're gonna see a couple cases on how this is treated with pentoxifylline. Okay, so here we see a case of a partial priapism treated with pentoxifylline. So basically, it's just one case, which is about a 26-year-old man who was suffering for a partial priapism. Essentially, he basically hurt himself and developed a partial priapism. I actually touched on this in my PG1 video that I'll try to link it up here. But essentially, there's men in that video. I basically touched about this man that injured his penis because he was like a trapeze artist. In this case, I believe the trauma was because he was riding a bicycle or something like that. So sometimes you can injure yourself such that you cause a form of priapism. It can be like high flow or low flow priapism. I'm not sure in which case. I would imagine here is low flow priapism in the right cavernosum here. And so essentially he was discharged, and he was prescribed with pentoxifylline 400 milligrams twice daily. So essentially he just took this, and the pain eventually went away, and he suffered no impairment of erectile function, and also no further episode of partial priapism. So this one is a little bit interesting, but just because it was due to an injury, but it was treated with pentoxifylline. Here we have another study, basically the effect of pentoxifylline on the cavernosal tissue in the ischemic priapism induced in the rats. So essentially, so they took a bunch of rats. So they put them into groups. In group 1, the control group, they basically just cut off the penis at the end of the experiments. In group 2, after 1 hour of the priapism, they took out the penis. In group 3, they received daily 10 milligrams of pentoxifylline for 4 weeks. After the 1 hour of the priapism, group 4 received daily 30 milligrams of pentoxifylline for 4 weeks. So basically a higher dosage. After the priapism. In group 5, basically even a higher dosage, which is 100 milligrams oral pentoxifylline for 4 weeks after the priapism. And then after the 4-week period, basically the penile tissues were obtained. And basically, so essentially the administration of pentoxifylline reduced the collagen density caused by the priapisms. in groups 3, 4, and 5 as compared to group 2. So the higher the dosage essentially was the more effective, but we see that it did indeed reduce the collagen density in this cases in the rat model. Okay, so here we have another study. The amelioration of penile fibrosis. Essentially, how do they combat penile fibrosis? So essentially, ED is associated with the loss of smooth muscle cells and an increase in fibrosis in the corporal tissue. So essentially, as we talked about, TGF-beta1 increases the collagen synthesis in the corpus cavernoso and the smooth muscles, and it's induced by hypoxia, long-term hypoxia in this case. As you saw in my PGE1 video, my first one. So apparently, so hypoxia can induce TGF-beta1 expression and inhibit PGE synthesis. In a cell study, application of PGE1 was sufficient to significantly suppress TGF-beta1. So here we see that PGE1 actually suppresses TGF-beta1 synthesis. So that's something else that that's very beneficial of injecting PGE1 because it actually suppresses TGF-beta1. So PGE1 has been proposed as a treatment for Peyronie's, particularly if you have like bad ED. And I think in my opinion is that you should be injecting PGE1. The problem is there's no real studies for the pure treatment of Peyronie's using PGE1, particularly in the acute phase. But according to this, it is actually suppresses the TGF-beta1. Additionally, not just pentoxifylline, but as we see, like pentoxifylline could be good enough because if you inject or PGE1 or you take pentoxifylline, they can both reach the corpus cavernosum. The problem is reaching the tunica, the outer layers of the tunica, in which you could use like DMSO and pentoxifylline to reach those areas, or of course inject pentoxifylline directly into the plaque. So this study is actually very, very interesting. I'm not going to dive too into it. It's very, very interesting, but it talks about all the different ways in which you can basically induce corporal fibrosis and basically induce TGF-beta1. You have like nerve damage. You have like diabetes, aging, androgen deprivation. So it's particularly interesting in the context of like say finasteride. I'm not gonna really dive into it. You should be using a vacuum erection device in any case to if there's sort of any sort of corporal fibrosis due through any reason, VD plus pentoxifylline, you can actually essentially mediate, right, and deal with that. So I think it's something that if you're even worried about, if you're in any sort of androgen deprivation, is using a VD and pentoxifylline. Something that I used to do is basically I would time my input of pentoxifylline with my usage of a BD, such that I would guarantee that as much as possible that pentoxifylline would stay in my corpora as long as possible, as much of the medicine as possible, in addition to the combination with DMSO. In any case, here they basically say that treatment with pentoxifylline reduces penile fibrosis. So that last study only barely touched on pentoxifylline and talks about how they looked at the other studies, and basically we do see that pentoxifylline does inhibit fibrosis. In the context of that paper was around corporal fibrosis, so it's very, very interesting. So here we basically see that pentoxifylline is used for the treatment of corporal fibrosis, which is very, very interesting. And something like, as I mentioned, you may want to know about whether you're having priapisms, whether you're getting old, whether you're taking like a finasteride or the dutasteride. So it's just something very interesting. Okay, next I want to talk about how pentoxifylline has been specifically studied in the context of erectile dysfunction. As we already saw, in aging men, as your androgen levels go down, you start to develop fibrosis because of lack of androgens, but also because it's mainly because you're getting less erections, less oxygenated blood to the tissues, causes hypoxia over long term. That causes fibrosis, which shortens the penis. And it's kind of like a cycle that you end up getting worsening in erections, and that's kind of just what happens. In any case, I want to look at this study real quick, in which we see the uses of pentoxifylline specifically in the context of erectile dysfunction. So we look at this paper. It was from the European Urology. So pentoxifylline promotes recovery of erectile function in the rat model of prostatectomy erectile dysfunction. So this is like they simulated a prostatectomy in rats, and they basically wanted to see if pentoxifylline basically helped in the recovery of the erectile function. We already saw before, I think I mentioned other studies that, Cialis, it's very, very important after a prostatectomy, using a vacuum erection device, using PGE1 injections. These are all important after a prostatectomy, but really PGE1 ends up winning overall, at least in that one study that I looked at in my PGE1 video. So basically, they wanted to see whether pentoxifylline enhances the erectile function, a rat model of a cavernous nerve injury, which is what happened during a radical prostatectomy. So 40 rats underwent the nerve damage, crush injury, and were randomized into basically here are a few groups of pentoxifylline 25, 50, 100 milligrams per kilogram per day. 10 animals underwent a sham surgery. I'm not entirely sure what that means, to be quite honest. In any case, treatment continued for 28 days in a washout period of 72 hours. And let's look at the results. So the daily feeding of pentoxifylline resulted in significant improvement of the erectile function compared to the vehicle treatment in all treated groups. So after treatment with pentoxifylline, the expression of the nitrous oxide synthase in the dorsal penile nerve was significantly higher than the ones that basically weren't treated with pentoxifylline. Furthermore, pentoxifylline treatment prevented the deposition of collagen and smooth muscle cell loss in the corpus cavernosum. So there we see there yet again that even taking pentoxifylline is very, very useful in a lot of different contexts, particularly in aging men, in the inhibition of injuries, or rather what happens when you get an injury. And so I think it's very, very important. So here we see how it actually is useful in the treatment of erectile dysfunction. Okay, so next I want to touch about how we could potentially use this for PE. So, one downside is this is a medication. You need a prescription for this. So unless you have Peyronie, I don't think you could potentially get it unless you have some sort of issue or you can potentially get it. I got it because I developed Peyronie. And I took it a lot during my acute phase, and I took it in combination with DMSO, as I mentioned. But if you have Peyronie or you can get your hands on it, how could it potentially use it in the context of PE? So number one, it prevents and inhibits the inflammation. So it has the anti-inflammatory effects. It allows more blood to go through the small blood vessels that you have in the penis. So basically this allows you to heal up a little bit faster, deliver nutrients and oxygen to the blood vessels. So if you're working it out a lot, this could potentially help in healing better, faster. It prevents the irregular collagen deposition. So if you're constantly injuring yourself, through jelqing, which I don't recommend doing, but heavy weight hanging or whatever, you're basically able to inhibit TGF beta 1 creation and the collagen deposition and irregular collagen formation. So this helps you, over time, just basically not have a penis that's full of scar tissue, which is what you don't want. You want nice, elastic, normal tissue. So pentoxifylline could potentially help there. So you can use it as a safeguard against injuries. So if you're taking it, alongside you're not developing any sort of corporal fibrosis, or you injure yourself, your penile tissues are basically well protected against TGF beta 1, such that it basically kind of we're almost like a seat belt, right, when you're doing PE, which is really interesting. It does decrease the collagen production and actually increases collagenase production. So collagenase is basically it's an enzyme that basically breaks down collagen. So it could potentially make even the gains better by helping break out or weaken the collagen fibers, such that you're able to more easily elongate that tissue, right? So I think this is some of the ways that we could potentially use it in the context of PE. Okay, next I want to talk about dosing and side effects. So basically, what you would take is the dosage comes in 400 milligrams per tablet, and they come in an extended release. So as I mentioned, basically your body starts to break this down very, very quickly. In reality, it lasts about half an hour of the active metabolite in your system, and it gets broken down again very, very quickly, such that very little of the active ingredient is actually in the plasma in your blood at a particular point in time. So what the studies recommend is that you do it 2 to 3 times a day with meals. And the reason for the meals is because of some of the side effects. I used to take it 3 times a day, with breakfast, lunch, and dinner, essentially. And I had no side effects. Potential side effects could include nausea, vomiting, bloating, diarrhea, like discomfort in the abdomen, bloating, dizziness, and headache. Sometimes I think at the very beginning I had a little bit of dizziness and headache, but it's hard to pinpoint exactly what it was because I was also taking I also take Cialis, but over time like that went away, and it really I had like no side effects. And then I would take it in addition to orally, I would take it via DMSO, sort of kind of mimicking a little bit what that other study did, in which they injected it directly into the plaque. So I would combine it with DMSO. Now I'm gonna have that I should have that video of DMSO, and so make sure you stay tuned, subscribe, help like, comment, and subscribe to help support the channel, and keep an eye out for that DMSO video, in which I will explain how to formulate it, how to best create it, and what you can mix in to help not only treat Peyronie's, reverse the effects of Peyronie's, but also in the context of PE to maximize gains, right? So, and in any case, that's the dosage and the side effects. So there you go. I think that was a very extensive, informative video, very nerdy. I think this will be mostly appreciated by all the PE nerds out there, and also people with Peyronie's. I try to put a lot of thoughts into it, and it took me a long time to sort of do all this research and come up with a conclusion. There's something that I took a long time and did for a long time, and it did help maximize my gains and help me resolve a lot of my Peyronie's. Over time, I stopped taking it, mainly because I think I didn't see any more effects. To be quite honest, I was very happy with my results for a long time. It was only recently that I've been inspired to I took a break for like about a year. Only recently that I've been inspired to go beyond that, right? Like I regained my size, I gained some size, but now I want to go even beyond that. And so this is why, I'm looking at all of this and how we could potentially use it for the context of PE. So, hopefully you enjoyed this video. Make sure you support me. I put the Cash App down there, so throw some shekels my way if you can. But really, really, really the best way that you can support me is by subscribing to my channel, leaving a like on this video, and just spreading the word, to anyone that, may be dealing with Peyronie's, maybe dealing with any sort of injury, and they really don't know, how to deal with it. It's really what this channel is all about, and how you could potentially end up with an even bigger, better, faster, penis than before. And so that's kind of been my story and why I really created this channel. So in any case, keep an eye out for more videos, particularly that DMSO video, as I think I've been working very hard on it. So I think it's going to be very, very interesting, and more product reviews. I'm going to review the Franken extender, the Mel hanger, and a couple more products. So it's going to be real interesting. A couple more like skincare products. In any case, check out more of these videos which may be relevant to you. Make sure you subscribe, and I'll see you next time. Peace.